Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, everything you need to know about the tuberculosis vaccine. The tuberculosis vaccine, also known as the bacille Calmette-Gurin BCG vaccine, is used to protect against tuberculosis, TB, and related complications. The BCG vaccine is no longer routinely given in the United States and isn't recommended for the general population according to the Centers for Disease Control and Prevention, CDC. However, it's still given to babies and young children in many countries worldwide. /r/n/r/n The tuberculosis vaccine may also be considered in the United States for certain people with significant risk factors for prolonged exposure to TB. The vaccine is also sometimes used to treat bladder cancer and tumors, among other uses. /r/n/r/n Deycke 77, Getty Imagesrnrn During the early 1900s, the BCG vaccine was developed by researchers Albert Calmette and Camille Gurin to protect against tuberculosis and related complications. It was in wide use in parts of Europe, like France and Germany, by the 1920s. /r/n/r/n The vaccine fell out of favor after the Lbeck disaster in 1930, in which 251 children received 3 doses of oral BCG that were contaminated with the pathogen Mycobacterium tuberculosis. As a result, 73 infants, who were a part of the clinical distribution in Lbeck, Germany, tragically died in the first year after receiving the problematic version of the vaccine. /r/n/r/n In the resulting 1931 trial, physicians George Deycke and Ernst Altstdt were found guilty of negligent manslaughter. The tragedy in Lbeck spurred distrust in the vaccine, although it was actually contamination of the vaccine that caused the tragedy. It took more than 10 years, new administration methods, and an increase in TB cases for public interest in the vaccine to rise again. /r/n/r/n More than a decade later, the BCG vaccine came back in response to rising global tuberculosis rates after World War II. It spread to more European countries in the 1940s and 1950s, including Great Britain. /r/n/r/n The tuberculosis vaccine is no longer routinely administered in the United States. Studies have shown mixed results in terms of the vaccine's effectiveness. Some people who have received the vaccine may also get a false positive result on a tuberculin skin test, TST, which can complicate treatment plans and lead to confusion. /r/n/r/n While BCG vaccination may cause a false positive skin test result, when the test indicates that the disease is present when it is not, getting the BCG vaccine will not cause a false positive TB blood test. /r/n/r/n Additionally, the risk of TB in the United States is so low that the benefits of getting vaccinated may not outweigh the potential downsides. /r/n/r/n Mandatory BCG vaccination is now somewhat controversial, but many countries with a high incidence of TB cases continue to vaccinate newborns due after birth. Globally, around 23 million people die from TB disease and related complications yearly. Deaths from tuberculosis are particularly common in developing countries and countries with high rates of HIV, as well as in environments like nursing homes, prisons, homeless shelters, and hospitals. /r/n/r/n In the United States, the CDC recommends that the BCG vaccine be considered only for the following groups. /r/n/r/n The BCG vaccine is given to infants on a regular basis in over 180 countries. According to the World Health Organization, WHO, many countries in Southeast Asia, sub-Saharan Africa, and the former Soviet Union have high rates of TB disease. There are also high TB rates in other parts of Europe, Africa, and Asia, as well as parts of the Americas. /r/n/r/n countries where there is a high incidence of tuberculosis include /r/n/r/n. The risk of developing drug-resistant TB disease is extremely rare while traveling internationally. However, your healthcare provider may recommend that your child receive the BCG vaccine if you are planning to travel to a country with high rates of TB. If your child is under 5 years old. /r/n/r/n. If you plan to travel to a country with high rates of tuberculosis, especially drug-resistant tuberculosis, the CDC recommends a tuberculin skin test or blood test first. If you test negative, you should get another test 8 to 10 weeks after returning to the United States. /r/n/r/n. Take any recommended precautions against infection if you spend time in a high-risk environment, such as a healthcare setting. /r/n/r/n. The BCG vaccine is most effective in babies and children under 5. Older children and adults may not benefit as much from receiving it. However, people of all ages may still be considered for the vaccine if they have certain risk factors. /r/n/r/n. In areas where the BCG vaccine is routinely administered, it's usually given to newborns. For example, the BCG vaccine is recommended for all newborns as part of the Hong Kong Childhood Immunization Program. /r/n/r/n. Recent research suggests that the tuberculosis vaccine is only significantly effective in preventing severe disease in children under age 5. Among kids age 5 and up who haven't had a positive TB test, some studies indicate that BCG vaccination doesn't offer reliable protection against TB disease and related complications. /r/n/r/n. Tuberculosis is an infection caused by the bacteria Mycobacterium tuberculosis. Usually, M. tuberculosis bacteria attack the lungs, which causes pulmonary TB. Symptoms of pulmonary tuberculosis include a severe, persistent cough, chest pain, and coughing up blood. Other symptoms of TB may include /r/n/r/n. In some cases, M. tuberculosis bacteria can attack other body parts, such as the spine, brain, or kidneys. Many people who are infected with TB don't have any symptoms. This is known as latent TB infection, LTBI. People with LBTI can't spread TB to others. /r/n/r/n. However, about 5% to 10% of people with LTBI develop active TB. People with TB disease have symptoms and can spread M. tuberculosis through actions like coughing, speaking, and singing. Screening for LTBI is recommended for anyone at greater risk of exposure to TB. /r/n/r/n. If left untreated, TB can be serious and even fatal. Tuberculosis is especially dangerous for immunocompromised people, including people with human immunodeficiency virus, HIV. /r/n/r/n. In the United States, tuberculosis cases are relatively rare. In total, 8,300 terabytes cases were reported to the CDC's National Tuberculosis Surveillance System in 2022. Rates of TB disease in the United States decreased consistently from 19,932,019. /r/n/r/n. They briefly declined sharply, by 19.9%. During the beginning of the COVID-19 pandemic in early 2020 and rose by 9.4% in 2021. Still, the overall number of US TB cases in 2022 was lower than in 2019. /r/n/r/n. The TB shot is not given routinely in the United States. However, you can ask your healthcare provider about getting the vaccine if you have a significant risk factor for TB disease. It is still given in several countries throughout the world, including China, India, and the Philippines, among others. /r/n/r/n. They may be able to give you the vaccine themselves in their office, or they may recommend that you visit a different clinic or local health agency to be vaccinated. A nearby TB control program may also offer vaccination. /r/n/r/n. Evidence of the effectiveness of the tuberculosis vaccine is somewhat mixed. According to a 2022 systematic review and meta-analysis, the BCG vaccine was found to be 18% effective overall in protecting against tuberculosis disease and related complications. /r/n/r/n It is primarily effective in infants and young children. It is, however, very effective in preventing young children from getting severe forms of tuberculosis like tuberculosis meningitis and miliary tuberculosis. /r/n/r/n The most common side effects of the BCG vaccine include /r/n/r/n Very rarely, BCG vaccination can lead to serious complications, such as abscesses or bone inflammation. /r/n/r/n You shouldn't get the tuberculosis vaccine if you /r/n/r/n The BCG vaccine is a live vaccine. It uses a weakened strain of Mycobacterium bovis, M. bovis, a bacterium closely related to the one that causes TB. Other ingredients include /r/n/r/n As with other vaccines, the tuberculosis vaccine has been thoroughly tested and vetted for safety. /r/n/r/n The bacille Calmette-Gurin BCG vaccine, or tuberculosis vaccine, is used in certain countries worldwide to prevent tuberculosis, TB, infection and complications. Typically, the vaccine is given as a shot in the upper arm to infants just after birth. The tuberculosis vaccine is safe, but evidence of its effectiveness in protecting against TB is relatively mixed. /r/n/r/n The BCG vaccine is no longer widely used in the United States. However, according to the CDC, the BCG vaccine may be considered for children and adults with a high risk of tuberculosis exposure. Examples include healthcare workers and children who are regularly cared for by adults with drug-resistant tuberculosis or untreated TB. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.